1. Which of the following is not within the OTA scope of practice? A. Implementing treatment plans. B. Conducting initial client evaluations. C. Assisting clients with adaptive equipment. D. Documenting therapy sessions. 2. The primary purpose of an adaptive device is to A. Improve a client's physical strength. B. Compensate for a loss of function. C. Increase range of motion. D. Enhance social engagement. Three. Which is a key principle of the Occupational Therapy Code of Ethics? A. Veracity. B. Speed. C. Discipline. D. Individuality. 4. What is the best course of action if an OTA suspects client abuse? A. Report it to the supervising OT immediately. B. Ignore it unless there's proof. C. Discuss it with the client's family. D. File an anonymous complaint with the licensing board. 5. Which activity would most likely be included in a fine motor skills intervention? A. Using scissors to cut paper. B. Jumping rope. C. Walking on a treadmill. D. Throwing a ball. 6. Which diagnosis is most associated with decreased proprioception? A. Parkinson's disease. B. Rheumatoid arthritis. C. Stroke. D. Autism spectrum disorder. 7. For a client recovering from a stroke, the best activity to improve bilateral coordination would be A. Playing a card game with one hand. B. Typing on a keyboard. C. Folding towels. D. Using a treadmill. 8. What does the acronym SOAP in documentation stand for? A. Subjective, Objective, Assessment, Plan. B. Situation, Observation, Action, Performance. C. Subjective, Observation, Activity, Plan. D. Symptoms, Outcomes, Analysis, Planning. 9. Which of the following best describes a client-centered approach? A. Focusing on measurable outcomes. B. Prioritizing the client's goals and preferences. C. Developing a plan independently of the client. D. Following predetermined protocols. 10. In the developmental sequence, which skill typically develops first? A. Sitting independently. B. Rolling over. C. Crawling. D. Walking. (11) What tool is commonly used to assess grip strength? A. Goniometer. B. Dynamometer. C. Inclinometer. D. Sphygmomanometer. 12. Which intervention is best for a client with decreased attention span? A. Providing short, structured tasks. B. Introducing multiple activities at once. C. Using loud music during sessions. D. Encouraging extended task engagement. 13. Which body structure is primarily involved in fine motor coordination? A. Cerebellum. B. Medulla. C. Cerebrum. D. Brainstem. 14. In the biomechanical approach, what is the primary focus? A. Cognitive function. B. Motor performance. C. Social participation. D. Emotional regulation. 15. An OTA is working with a client with COPD. What should the OTA prioritize during therapy? A. Energy conservation strategies. B. High-intensity aerobic exercise. C. Deep muscle strengthening. D. Prolonged walking sessions. 16. Which of the following is a contraindication for joint mobilization? A. Chronic arthritis. B. Hypermobility. C. Muscle weakness. D. Limited range of motion. 17. A patient with a spinal cord injury at C5 will most likely require assistance with A. Breathing. B. Feeding. C. Walking. D. Verbal communication. 18. For a client experiencing anxiety, the best relaxation technique would be A. Deep breathing exercises. B. Resistance training. C. High-intensity interval training. D. Jump rope exercises. 19. What is the primary goal of splinting in occupational therapy? A. To improve circulation. B. To prevent deformities and support function. C. To enhance muscle bulk. D. To eliminate pain completely. What should be included in a discharge plan? A. Future therapy goals and recommendations. B. Details about the therapist's credentials. C. List of unresolved client conflicts. D. Administrative policies. Which sensory system is targeted during vestibular stimulation activities? A. Visual. B. Auditory. C. Balance and spatial orientation. D. Olfactory. OTA. An occupational therapy assistant or OTA is a healthcare professional who works under the supervision of a licensed occupational therapist or OT to help individuals of all ages develop, recover, improve, and maintain the skills needed for daily living and working. OTAs play a crucial role in implementing treatment plans and supporting clients in achieving greater independence and quality of life. Here are 5 top beneficial uses of OTA. 1. Enhancing independence in daily activities. OTAs help clients improve their ability to perform essential activities of daily living or ADLs, such as dressing, grooming, cooking, and mobility. By implementing personalized strategies and adaptive tools, OTAs empower individuals to live more independently. 2. Promoting recovery and rehabilitation. For individuals recovering from injuries, surgeries, or illnesses, for example, stroke, hip replacement, OTAs assist in rehabilitation programs that enhance physical strength, coordination, and functional skills, accelerating recovery and improving quality of life. 3. Supporting emotional and social well-being. OTAs work with clients on improving social interaction and emotional resilience. They help clients manage anxiety, stress, or depression by encouraging engagement in meaningful activities and hobbies, promoting mental health. 4. Facilitating adaptation through assistive devices. OTAs train clients in using assistive devices like wheelchairs, walkers, and prosthetics, as well as adapting home and work environments for accessibility. This improves mobility, safety, and overall functionality. 5. Providing tailored care across life stages. From helping children with developmental delays to assisting older adults with age-related challenges, OTAs provide care tailored to an individual's needs. They address sensory, motor, and cognitive challenges at various stages of life, ensuring optimal client outcomes.